Thompson Health Rehabilitation Services incorporates physical therapy, athletic training, occupational therapy, and speech therapy. We have, in our outpatient environment, over 26,000 annual visits, and all of our services are now recently certified through the Joint Commission with an advanced certification in orthopedic rehabilitation care. Our director, Carol Drake, came forward and said, we need to have something that sets us apart from the competition. I think there's an opportunity to look at a system that may help us get our patients back to ambulating faster. And would I be interested as the COO of seeing the system and seeing what it could do for our patients? One of the things that we noticed is that they have this system on the inpatient side, and so patients were getting discharged to home and there wasn't a system for them to go use and continue their care. So we looked at being the first in the region to provide that care, and it's been a huge draw for people once they're discharged from the hospital. We looked at two different systems, and SafeGait stood out for a couple of reasons. One is the level of interaction that we had with the staff. So we were able to go look at the equipment. I was able to get a demonstration myself and really look at the benefits of what it had to offer. The other add was we worked with the SafeGait staff to look at our return on investment for this program. It was new to us, so we really had no way to understand how we were going to calculate this. So working with them and then looking at our own business, we were able to come up with a return on investment that made sense for us. We actually exceeded our expectations with the return on investment. So we calculated having just 2 people a day in the machine, and sometimes we're triple that number. Well, one of the benefits that SafeGait allows is that our therapists can be 1-to-1 with the patient, and we no longer have to be 3-to-1 with a patient trying to help them ambulate. So it's safer for the patient because they're in a system, but it's also safer for our staff, and it's more productive for our staff. So the staff that were used to ambulating with the therapist so that they could catch a patient if they fall are now able to see their own patients. And so they're more productive, and so we've been able to grow our volume almost 10%. So the technology on the front end may seem expensive, but when you look at the ROI calculator and the value that you can get by having other therapists be productive, it easily pays for itself. The benefit is then being able to service the community in a greater way. So you can open up schedules for those therapists that would be assisting this patient to ambulate, and you can serve your community in a better way by doing that.